Well, the daily COVID-19 case average is more than 3 times higher than it was on Labor Day last year.
Labor Day travel plus packed football stadiums across the country is raising concerns about another COVID surge.
Earlier today, we talked with UW Health Chief Quality Officer Dr. Jeff Pothof. It was a very busy weekend in Madison with Summerfest and the football game and Taste of Madison. How concerned are you about all these big gatherings?
There is some concern there. On the plus side, a lot of these gatherings over the Labor Day holiday are outdoors. But unfortunately, many of them do involve folks, very close together, like shoulders touching close together. And in that situation, with the high levels of COVID that we have in the community, if those folks are unmasked, particularly if they're unvaccinated, that does pose some risk to have some additional cases develop in our area because of those events.
Football gatherings like the one at Camp Randall on Saturday happened all over the country. It was not just in Madison. And I wonder if everyone was just so excited to have football back that we dropped our guard a little bit and forgot that we're still in the middle of a pandemic. So when do you expect to see a spike in cases down the road, and how soon down the road?
So typically what we've seen after, large events, whether they are here or, other parts of the country, holidays in the past during the pandemic, is it takes anywhere from 3 to 5 days for symptoms to develop in people where they're going to go, maybe this is something I should pay attention to. Usually takes a few more days for them to say, you know what, I really better get a COVID test. They get that COVID test, a day later, they'll know if they're positive or not. That's when we would see those positive cases. So anywhere from 7 to 10 days after an event is when we should start seeing data coming in that would suggest that we have some additional cases than just our normal baseline that we're seeing right now.
And what's your gut about it? Do you expect to see a big spike?
It's hard to say whether we're going to see a big spike. My gut's been wrong before on this. We were worried last year during Thanksgiving holiday, Christmas holiday, that we would have a lot of gathering and a spike in cases. At the same time, we have seen cases come out of the Deer District and other large gatherings, just a little while ago. So I do think there will be cases that come out of these gatherings. Whether it's a large number of cases or a big spike remains to be seen. But I don't think we'll have any news that says, with Camp Randall football game or Summerfest, that 0 cases came out of there. We're just not going to be that lucky.
The governor's extended his incentive for $100 for people to get their first vaccine. Is it doing any good? Does that help?
I had heard that, in Wisconsin, it was maybe having some effect. It seems like the effect is kind of hit or miss as you go around the country. I think for folks that need that incentive as a way to motivate them to go through the work of getting a vaccine, it may be helpful. I still run into people in the emergency department who are telling me that they just didn't get around to it. They didn't have time to schedule their vaccine. Having a financial incentive might help with that. For others, I think, they're so philosophically opposed to the vaccine, $100 may not make much of a difference to them.
But it's not too late to get a vaccine, is it?
Never too late. And I think, with the amount of Delta in our community right now, it's a good time to get vaccinated if you're not vaccinated. I think this idea that, you can just lay low and not be exposed to the virus really isn't based in reality. Either we're going to be vaccinated and come across the virus at some point, or we're going to be unvaccinated and come across the virus at some point. And the difference in outcomes between those two different scenarios is significant. You really want to be in that vaccinated camp the day that COVID comes knocking on your door.
And the numbers prove that. I mean, most people in the hospital or people seriously sick are unvaccinated, correct?
Absolutely. So even if you look at, rate of conversion to positive, unvaccinated are going to convert at a much, much higher rate than those breakthrough cases that we hear about. And then for those that are both infected with COVID, nearly all of those that are severe cases are in the unvaccinated. That's who's filling up hospital beds and ICUs.
What is our latest guidance on boosters? Where are we with booster shots, especially in relation to people who got the 1-dose Johnson & Johnson vaccine? What's the latest on that?
Yeah, I think a few things. For the Johnson & Johnson vaccine, it looks like there's data that's forthcoming that is going to suggest that a booster is going to be helpful. For the rest of us with those mRNA vaccines, particularly the Pfizer vaccine, there was this date put out there of 9/20. Right now, I think we're waiting for another announcement, more information from the CDC and the FDA, those organizations that are actually looking at all of the data available right now and saying, yeah, 9/20 sounds good, or maybe they pick a different date. I do think boosters are coming, but I'm not so sure it's going to be right on that 9/20 date.
But if you got vaccinated, you're still being protected.
Absolutely. I mean, if you're vaccinated, your likelihood of having a disease with COVID-19 coming down with it is decreased. If you're vaccinated, your likelihood of getting very sick and being in the hospital is significantly decreased. There's really a ton of upside to being vaccinated and almost no downside.
And if you're vaccinated, do you think it's okay to go to gatherings like the ones we saw this weekend if you take the appropriate protections? Or do you think people going into the fall might want to be a little more cautious?
You know, I think if you're vaccinated and you're going to go to some of these events and you take those simple precautions of throwing a mask on when you find yourself close to other people, really close, you can reduce the risk enough where that becomes not an unreasonable event. If you're going to leave the mask at home, I start to worry a little bit. If you're unvaccinated, there really is no safe way for you to do those things without putting yourself and others in danger.
Keep that mask handy, that's for sure.
Absolutely.
Doctor, good to see you again.
Thank you, Dr. Pothof. Always good to talk to you. We'll see you soon.
Sounds good. See you later.
Bottom line, get vaccinated if you're not. That's the best protection you can have.